All right, ladies and gentlemen, my name is Patrick DeLuca. I'm the Chief Executive Officer of the Compassionate Cannabis Clinic here in Venice. Welcome to another monthly patient support group. The purpose of these support groups, which we have monthly, are to bring our patients, as well as anybody else that is curious about medical cannabis in Florida, together for an evening of discussion and education. Something a little bit different. This month is very interesting. We're doing the MMTC Showcase. And for those of you that might not know, the acronym MMTC stands for Medical Marijuana. That is the name of the organizations that get a license to cultivate, process, dispense, and distribute cannabis to legal patients in the state of Florida. Tonight, we have representatives from many of the current licensed MMTCs here. Tonight, you will hear presentations from them. We have, just to go through the list, I'll get to the list in 1 second. The purpose of our monthly support groups, we want people to come with an open mind. We want you to become involved, and we want you to be vocal with your involvement. The Board of Medicine had an emergency meeting on medical marijuana last week, and after delaying, I think, 6 or 7 hours, they finally got to medical marijuana. And when they got there, it was blatantly apparent, you can go see the videos for yourself, that the members of the Board of Medicine were not in having to do what the legislature made them do. One of our patients addressed the Board of Medicine, a gentleman by the name of Tim Gullett, for 9.5 minutes. And it was an honor that the advocacy that he was encouraged to do by us resulted in him speaking his mind and sharing his very personal story with the Board of Medicine. It was clipped down, posted on Facebook by Canna Chronicle, and as of right now has had over 112,000 views. So this is a hot button issue. Tonight, it's the MMTC Showcase, which is, from what we can gather, the first time any event like this has been done in the state of Florida. Typically, you'll have events where 1 or 2 MMTCs appear and give their presentations. We went to a conference, Dr. Gordon and I, this last weekend, and we had to sit through 6 presentations of CBD vendors and essential oil sellers. That's not what this is about. This is about medical cannabis. Tonight is about learning what products are available. Did my computer just die? Oh no, somebody bumped the table. I probably should tell the staff not to touch. There we go. Okay, that's the don't touch it. Tonight, representatives from Three Boys Farm, Aphria, Curaleaf, Knox, Remeny Wellness, Surterra, and Trulieve are going to come up to the podium, and they're going to educate you on what products are available and how their processes work for the creation of those products. With the time that we have remaining after the presentations, we'll open it up to audience Q&A, and that's what that microphone is right there for. So, without further ado, I'd like to bring Dr. Barry Gordon up on stage. Dr. Gordon?
Yeah, thanks, Patrick. I am going to take literally no time tonight because I know what I want to hear, and I know it's what all you want to hear, is what medicines are going to be available to us as we go forward here in Florida. What I can tell you so far is that as I look out at my family, and I think that's the difference about this, guys, and I want to talk to my dispensary bunch back there. These are our patients mostly, and I'm so proud of it, and I'm so proud to have you guys here and to have you a part of our cannabis community. I also want to welcome other physicians tonight who are here, and I welcome you. As you know, we've always had an open atmosphere in our clinic with our three-fold tenets of our practice: patient care, patient and community education, and advocacy. So I welcome the clinicians that are here tonight as well. I'm going to end with this. A half a mile down the road, everybody, the city of Venice, in their infinite wisdom, is voting to ban dispensaries, right? And, you know, it sure would be a heck of a lot better use of their time to be here tonight to see what's going on, because all they're doing is inconveniencing my patients. I mean, that's the truth. And I know you know, a year from now, they're going to look back on this time with foolishness, okay, within themselves, because they really don't have any idea of what we're all here for, which is wellness. So, you know, it's ironic, and I think, quite frankly, a national story of concurrence, that here we are, this community, with the largest single gathering of dispensary organizations ever in the state of Florida. And I'll be honest with you, I'm proud of that. I'm proud that Patrick and I were able to put that together. And that's what it should be. No one here paid a dime, not you guys to be here, not those guys to be here. It's all about bringing everybody together as a community so we can continue to pull on that rope. Because we know there's a lot of money on the other side. They don't have the people on the other side. They may have the money, but we got the people. So that's my goal, is to educate not only you guys, but other physicians, right? So that as I help my patients, other physicians can do the same. So we're going to continue to pull. But how ironic that there they are, about a half mile. They were also talking about banning physician practices, Patrick, or something that also incorporate medical cannabis. I don't know how they can do that, you know. But anyway, we're not going to worry about it. I'm going to end so that we can get the dispensary guys up here doing their thing, and very much appreciate everybody being here tonight. And let's keep on pulling on that rope.
All right. Okay. I got to make sure the audio levels are adjusted. I don't think Dr. Gordon actually needs a microphone. We just give it to him just because. All right. So the way that this is going to work is each of the MMTCs that are here tonight, I've given 10 to 12 minutes to basically come up here and introduce themselves to you and talk a bit about who they are, what products that they have available, and the extraction techniques that they use, and how they make the products that are available for sale. About 2 months ago now, maybe 3 months ago, we saw our first batch of new MMTC licensees. Up until June of this year, you had Surterra, you had Knox, you had CHT, you had Modern Health Concepts. There's somebody else that Green Solution. That's why I'm forgetting them. They were the licensees. After the law passed on June 23rd, those applicants for the MMTC process that eventually took their cases to administrative court over the scoring system that the state of Florida employed when they originally came out with this license process were awarded their licenses. And I'm honored tonight to bring up first Mr. Bill Monroe. He's the dispensary director of dispensary management for Three Boys Farm.
I hate being behind a podium. It kind of puts a barrier between me and you. I like to walk around and talk. I've been an advocate here in Florida for about 5 years. I started off, I was a caregiver for my mother. She had Parkinson's and colitis, and I took care of her for numerous years. January, And then I was working for Harris Corporation. I was a logistics engineer, and through my advocacy and working with other folks, this opportunity came up with working with Three Boys Farm. Three Boys, the name of that comes from Robert and Deborah Tornello. They have three boys, so therefore Three Boys Farm. Robert has been dealing in doing organic farming ever since the 1970s. He first started off producing a line of products for the zoos, and you even had China that came in and looked at them because they were buying bamboo for the pandas. And then from there he went to edible products, your lettuce, your pineapples, your papayas, your brown turkey figs, things of that sort. And it's all organic with proprietary soil mixes there. I can't when I'm in Three Boys Farm. We have ants coming in the bottom, and I just got to shoo them on out or get rid of the food. He will not use any pesticides or anything of that sort. It's all organic. He even does rainwater collection, so when it rains, we collect all the rainwater. We do solar, we do wind harvesting, we do air redirection, we do all that. So we try to do organic as much as possible. Realm, and Robert was the first one to get hydroponic in a form of that to get organic certification back in the 1970s. So he's been doing this and living this, and that's what we want to do with cannabis. We don't want to spray it with pesticides because when you extract cannabis oil, if any, concentrating that. And a patient's immune system's already compromised. Why would you want to give them something that's going to so that's what we're doing there. Everybody thinks that, you know, if you get in the cannabis industry, it's glamorous. You're doing all that. Well, I leave Monday at 5:30 in the morning from Palm Bay, Florida, and I drive 3 hours to Ruskin in my old. I check in, and I go back to my place where I'm staying. At 8 o'clock, I work till 8 o'clock at night. I go down to Publix, I grab some soup, I grab some crackers, I grab some tea, I go back to work, I get home with my family on the weekends. I have 2 twins, and one of them likes to run, so I'm there with her on Saturdays while she prepares for a marathon, and the other one, we're involved with her too there. So you got to do the hard work in any type of startup. We would have a lot of slides up here talking about Three Boys, but we're not even at that point yet. We're recovering from the hurricane. We're replacing some of the items there. We have to go through our inspection. So we didn't want to put up a slide showing things that are not 100%. We're not even at the point of doing a table yet. We just got the logo. That was refined even today from what I understand. So anytime you're involved with a startup, you've just got a lot of balls up in the air, and you got to make sure none of them drop. So that's where we are at the moment. It's a lot of hard work, a lot of time. You're spending a year, year and a half, 2 years before you even get to the point where you can take a breath and go, oh, now I can work like an 8-hour day at that point. So that's where we are. The range of products we're looking at pills, we're looking at sublingual sprays, nasals, the different types of vape cartridges. We have Dr. Greg Gerdeman from Eckerd College. So he was tenured at Eckerd College, quit his tenureship to come work for Three Boys to come up with a line of products there. So we have Dr. Greg Gerdeman, and we got Dr. Zeno from the University of South Florida, and we have a lot of tight relationships with the University of South Florida as far as the medical goes. So when you're talking about medical, just think Three Boys, think organic, and then think the fact that we have 2 doctors on our staff actually looking at the different products and how we're going along. You know, and we probably frustrate a lot of our investors because we take our time and we want to do it right and we want to do it medical. We don't want to just put something out there just for the patients. Reason why I'm here today is I continue doing this for my mother. I didn't have to quit a job that I was at for 25 years and then come here with a pay cut and then drive 3 hours in the morning on Monday and 3 hours on Friday and then work 12 and 14-hour days. So if you want to get in the cannabis industry, it's a passion. It's 3 steps forward, 2 steps back, trust me. And a cannabis day is very compressed. You'll do more in a cannabis day than you probably will do in a regular week as you're going along in that area. As we get started, we have going to have our first flagship, which is going to be in St. Pete. It's going to be in a very large facility there. That's going to be our flagship center, and then we're looking at other places in the Southwest for right now as what we're concentrated on. You're limited to the number of dispensaries you can put into a region, and the state comes up that. They say you can only put X number here and then X number there, and you go on from there. So we will be hiring in the future. We'll be looking for dispensary managers. We'll be looking for staff. We'll be taking our dispensary managers, growing them up into regional managers over time. What John and I believe in, John's the chief operating officer, What we believe in is growth and opportunity. We believe taking our people and growing them up. And we're going to be hiring across the board, black and white, rich and poor, straight, gay. I've got all kinds of resumes in there in all different groups I'm working from. We don't discriminate, and we're across the board there, and we're organic and everything. So that's where we are at the moment. We're waiting to get our inspection with Director Bax from the state of Florida. We have to go through and get the cultivation inspection, then we have to get the extraction, then we have to get the dispensary, and then we get the delivery. 4 inspections before you can even do anything. And a lot of times they go, well, no, you're not there yet. Come back, you got a punch out list, and you got to do these other items. So again, getting into the cannabis industry is not an easy thing. It's not like a quick check off. You have to go through all these control gates, and there's a lot of money and time involved. Right now at Three Boys, we have people pulling cables all around the greenhouse, setting things up for wireless. We've got people working in all different areas, and we're trying not to trip across each other going along. So that's where we are. Sorry, I don't have a lot of slides. We don't have a table yet, but we didn't want to put anything out there that was 50%. We want to do things 100%. And thank you for your time. I'll be around for the question and answer.
All right. And we will do a question and answer session at the end. So if you do have some questions, keep that in mind. Our next, by the way, we're going in alphabetical order. So we didn't want to show any preference to anybody. It's all alphabetical order. So next up is Aphria. Aphria is formerly known as CHT Medical under new management, and we've got Ashley here to tell you all about them. Do you want the podium? Perfect. And then if you want to move forward, you just do.
Okay, great, thank you. Hey guys, how are you tonight? So happy to see so many smiling faces here. That makes us very excited. I know everybody else is too. My name is Ashley Tynes. I am a territory sales manager for Aphria. Aphria is a company that has been the largest medical cannabis dispensary in Canada for the last 5 years, and they are now moving into the United States. Florida was one of their first stops. And as Patrick mentioned, we used to be a company called CHT Medical. We are located in Gainesville, and Aphria came in and thought we looked very attractive to them to break into the US and Florida, so here we are as Aphria. So I'm going to tell you a little bit about our company, what we can offer you guys as patients, kind of how we do things, our processes, and then some new and exciting things that are coming down the pipe as well. We are a global leader in providing patients with safe and effective medical cannabis products. We're committed to producing a range of high quality, safe, and pure medical cannabis products to meet our patients' needs. And we go beyond basic regulatory requirements to ensure that we provide safe, consistent, and effective medical cannabis products to patients in need. One of the things that I found very interesting about Aphria when I was researching the company was that the founders of the company come from both the agricultural side and the pharmaceutical side. So they've learned how to combine those two industries very well to really bring patients a true pharmaceutical grade medical cannabis product. We are based, like I said, we're right outside of Gainesville in Alachua. That's where our greenhouse space is located. In August was when our license transferred to Liberty Health Sciences, which is the parent company that we function under, that falls underneath the Aphria umbrella. Like I said, they've been operating in Canada since December 2014, but they've been, medical cannabis has been legal in Canada since 1996, I believe, so they've been doing it a long time. And our expertise lies in low-cost, large-volume growing. So we're trying to produce the highest quality medical cannabis product at the lowest cost. If you ever go to our website, this is what you're going to find. It says, "Welcome to Aphria." It also will say, "Powered by sunlight." We are 100% greenhouse grown. We're 100% organic. We use absolutely no pesticides. I found this interesting when I went and toured the facility for the first time. We use what are called good bugs to kill the bad bugs. I'm not a bug lover, so I don't necessarily think any bugs are good, but apparently they work well at our facility, so we'll just let them handle that and I'll stay out of it. We really believe in superior patient care and safe and consistent products. I already said 100% greenhouse grown, no pesticides, biological predators. I guess that's a fancy way to say good bugs. And you don't have to worry about pesticides or anything in your medical cannabis products that could possibly harm you. We do intensive testing to make sure that that doesn't happen. This is a little bit about our process. Our plants come from the greenhouse into our production area. They're stripped, leaving only the buds. The buds are dried and activated into those different components. The dried and activated buds are then extracted using CO2. So we have a CO2 extraction process. It's a very large, very complicated, scientific-looking piece of equipment that is very expensive, and it actually takes all of that dry flower and squeezes the oil out of it. And then the cannabinoids are extracted from the plant material and split into our 3 different product lines. We do extreme testing to make sure that there isn't anything in your products that you don't want in there. So we test for potency, heavy metals, terpenes, residual solvents. After we do all of that testing, then we create our formulations, which basically you will find that we have tincture oil, we call it oral solution, so they're like sublingual drops. We have capsules, and then we have our vaporizer pens. And then after they're in formulation, then we actually do more analytical testing for potency, terpenes, and microbials. And then those products are finally come into their packaged state, which is what they're going to be in when you get them. We do deliver for free all over the state of Florida, so we don't have any brick and mortar locations right now. We are opening some in December, but you don't have to come to us because we come to you, and we do it for free. We have different product strengths from high to low. Our high products, high THC products include indica, sativa, and a hybrid of both. And then we have what are called our balanced line, which is a 1-to-1 ratio of both CBD and THC. And then we have our CBD products, which are considered THC products. Again, we have capsules, oral solution, and vaporizers. And then we do have some other formulations that are coming down the pipeline, which I will tell you about a little bit later. Again, we deliver free to patients statewide. We do offer various discount programs, 10% off your first order, 10% off every order if you're a veteran, 10% off financial assistance each order, and we do those on a case-by-case basis. Our new locations that will be available in December are going to be in the Villages, Fort Lauderdale, and St. Petersburg. And what that allows us to do more than you just being able to go into a location is actually allows us to deliver to more areas more often. Right now we have a delivery schedule because we're delivering out of Gainesville, where we might be in Miami one day and we might be on the other coast one day. These locations will allow us to deliver to more places more often, so it'll be more convenient for patients. We have additional dispensaries opening in Q1 of 2018, so we're really excited about that as well. And we have some new products and exciting partnerships that are coming soon. These are our commitments. We are committed to safe and consistent products. We go above and beyond industry standards to ensure that you receive high quality and consistent medical cannabis products, because when you take medical cannabis, you want it to be exactly like if you took your cholesterol medication, correct? So you want to make sure that what is in that capsule or what's in that oral solution that you're taking is the same consistency every single time, and that's what we really strive for at Aphria. We have patient-driven innovation, so we offer innovative delivery technologies that enable accurate dosing and improved health outcomes, and we really listen to our patients. So if you all have ideas about things that you think might work for you or something that you'd like to see down the road, we want to hear those ideas. We offer superior patient care. We have knowledgeable and compassionate patient care team. I think I've told a lot of you about our patient liaisons that you call our number when you want to talk about your order, and we can actually look your order up in the registry for you, talk you through our products, talk to you about what you're looking for and what kind of basically disease state or ailment that you're trying to treat, and really try to work with you to find what's going to be the best solution for you. Whoops. we understand that all of your situations are completely different and that everyone is unique, and that's why our team is committed to providing continued guidance, information, and support through your entire patient experience. We're here to answer questions for you, so please don't hesitate to ask us anything. And this is our website. I encourage you to go to aphria.com. You will see that there is a distinction between Aphria Canada and Aphria US Florida. Take a look at both of them. The laws are different in Canada, but you'll get an idea of how the company functions and a little bit about what we've been doing for a long time there as well. I know that I talked a little bit about new things coming down the pipe. We just had a press release today that I want to read to you about some things that are happening. I'm just going to read it word for word. Liberty Health Sciences, which is our company that functions here under the Aphria umbrella, today announced a partnership with Colorado-based Technology Holdings to bring its award-winning line of Mary's Medicinals cannabis products to the Florida market. Under the 3-year agreement, Liberty will produce and distribute a suite of effective and reliable products from Mary's under license in the state of Florida to further optimize patient care. The agreement is subject to approval by the Florida Department of Health, Office of Medical Marijuana Use, and is required under Florida law. And then these are some of the products that are going to be available under this agreement that we've signed with Mary's Medicinals. The agreement with Mary's allows Liberty to license and produce the following products: transdermal patches, transdermal gels, transdermal topical compounds, capsules, tinctures, muscle freeze, vape pens, and distillates. So these are some of the new and exciting products that we're going to have available. I'm not sure exactly what the timeline is on all of them, but it's something that we're really excited about, and we partnered with this company because they've been doing this and they know what they're doing, and we wanted to really have a reputable partner in being able to bring these new products to market. So we are waiting for the state of Florida to release basically the rules around all of these new things, edibles, things like that. We don't know exactly what the rules on those are going to be yet, but as soon as we have them, we're excited to bring those products to you. So if you guys have any questions later on during question and answer, or even in between, I'm at the table in the back. You'll see our tablecloth, and please come and ask. I'd be happy to answer anything that you possibly have to ask, okay? Thank you all so much for your time. Thank you.
Right, here's your click. Thank you. Yeah, that Mary's Medicinals thing is actually a pretty big deal. For patients that have been in the office in the past 6 months, those little black books that we hand out are Mary's Medicinals Cannabis 101 handbooks. And Mary's Medicinals was nice enough to send them to us. So they sent us, I think, 1,000 of them just for free, just to give out to people. So that's big news, and that just broke today. Again, we're going in alphabetical order. So next up is Curaleaf. Please give Miss Lorraine Johnson a big round of applause.
Hi, everybody. My name is Lorraine Johnson, and I am the Physician Outreach Liaison on the west coast of Florida. I wanted to thank Dr. Gordon and his staff for having us all here to be able to talk to you directly. I appreciate you guys coming tonight. I am with a company called Curaleaf, and Curaleaf is formerly Modern Health Concepts. So Curaleaf is a grower and dispensary out of Miami, out of the Homestead area specifically. 3 generations of farming, and basically Costa Farms are the farmers, and you may have heard of them. They provide plants and flowers to like Home Depot, Walmart, Lowe's, all sorts of different stores, and they recently got into the medical cannabis growing. So what we do is, like the other dispensaries, we produce medical cannabis, and we also have a low THC, high CBD product. We have our grow house, our farm down in Miami. Within our farm, on our property, we have a outside laboratory for testing. So we cultivate Miami, test on site for purity, process on site, and then we dispense. So currently we have one retail dispensary, one dispensary on site in Miami, and we're slowly growing, heading north. But you don't need to worry about that because we also, like most of the others, we deliver. So we deliver all the way from Miami up to Orlando, all the way north of Tampa. And we're pretty much, we can't do next day delivery, but we can work it out basically. So 1 or 2 days a week we can do a delivery in this area. And delivery is free. So as you guys know, Amendment 2 passed, and you guys all, if you're needing medical cannabis, you can go get the ID card, go get certified by a physician in opposite order. Okay, certification by a physician, get the ID card, which for many is taking 6 to 8 weeks or so, and with a hurricane maybe even longer. And then you can go to the dispensary and get the products that you want or have it delivered. I come from the pharmaceutical industry, never been for pharmaceuticals, never been for big pharma. I did sell it for many years. I did sell opioids and basically saw the destruction that opioids do to many people's lives. And I know there's a better alternative. And that's basically what brings me here today. And I'm happy to be able to represent a medical cannabis company and get that medication, get that product to you all. So as I mentioned, there are some frustrations in getting the medical ID cards. How many people here have their card already? So very small amount. How many people have applied? Yeah. So hopefully that will be remedied in the near future. The state of Florida, Department of Health is saying they're bringing on more staff, bringing out an outside company to help with that. You're better off applying online and following the rules with the help of your doctor in getting your medical marijuana card, making sure you send in the right picture, making sure you fill out all the information accurately, sending in your check, writing your ID number that the state gives you on your check. So as long as you follow all the rules, you should have your card in hopefully 6 to 8 weeks, and you can get started with treatment. This just gives some information on recommendations on getting your card and doing it right the first time so you can get started. As I mentioned, we have 2 different lines of cannabis. So we have the high CBD. This right here, I believe, is the 15-to-1 ratio. So with our products, and I'm not sure if this is across the board, but we always have the CBD listed first. So it's a ratio of 15 CBD to 1 THC. And this is known as Haley's Hope. Now, Haley's Hope, Haley was a girl in Colorado that had cerebral palsy and epilepsy. And she responded amazing to a 15-to-1 product called, and we named after her, called Haley's Hope. So this is available to you all in capsule form, vape cartridge, and oral oil. And pretty much most of our line comes in those methods of administration. We're just coming out with some topicals. As the lady before me said, we're looking into coming out with edibles, and we just recently came out with a high THC concentrate. That's the new concentrate. So this is what our dispensary looks like. So very threatening. We have people on staff to consult with you, to help you make and what product to use. We'll step of the way. We really recommend, as most doctors, or at least Dr. Gordon, to try different products. You may not like what Curaleaf offers. You may not like our strains. It may not have the effect that you're looking for. So try products from the other dispensaries. And you gotta also, in terms of dosing, do what works for you. It's very individualized, based on product, based on dosing. You know, it's what works for you. And I can't stand here and say that our products are the best products. They're great products, but it may not work best for you. So you have a lot to choose from. I know it can be really confusing, but we're here to help you navigate through the confusion. We do deliver throughout the state of Florida, like I said, up to Tampa and up to Orlando. But we are opening a new dispensary in St. Pete in 2018. So we're three boys, three guys. So they're going to have a little competition up there. So we're trying to make it more, just easier for you all to get the product other than delivery. If you want to visit a dispensary, if you want to talk to somebody in the dispensary, they're there for you. But in the meantime, with the delivery, our drivers are trained to consult with you. Our drivers know how to use the product. They can discuss with you the best ways to use the product and help you with any questions that you may have. Like a lot of the dispensaries, I would say most of the dispensaries, we offer discounts. We know the impacts of PTSD, so we offer a 20% discount always for veterans. 20% discount, we'll call this the Patty Gordon special. She got all the senior citizens a 20% discount. So we just added that today in honor of Patty. But we also offer, $50 on your first order to offset the cost of the medical marijuana card. So we're here to help you, to help make you feel better, to help get the product in your hands, and to help consult with you with whatever your needs may be. So thank you so much, and if you want more information, come back and see me at the Curaleaf booth.
Look at that, the Patty Gordon discount. Isn't that the most beautiful thing ever? Oh, Lorraine, you took my paper. Yeah, there you go. Yeah, I mean, here's the thing. The purpose of this event is for those of you that are legal patients, those of you that are waiting to become legal patients, and those of you that are just curious about how this all works. This is an opportunity for you to learn what products are legally available right now for patients in the state of Florida. We've got some seats for those of you that are standing. If you'd like a seat, we do have some seats over here. You might have to make friends with the neighbors, but we certainly feel your pain. My feet are killing me. Grow Healthy was supposed to be here tonight, but I don't believe that Darren is here, is he? Yeah. So we'll move on to the next. And the next would be Knox. So Alex, please give it up for Alex Carroll.
Hey guys, how's it going? My name is Alex Carroll. I'm the lead chemist for Knox Medical. I guess we're going to take a little bit different direction tonight. We're going to go more in depth about cannabis processing, hopefully educate you guys a little bit about what it takes to make the medicine. When I left Sanofi, pharmaceutical company, to work for Knox, I expected to breeze through it. I expected that maybe if I squeeze the buds hard enough, oil will start dripping out of it. I can just put it in a bottle and I'm done with it. Boy, was I wrong. So, I'm going to talk about how we do things at Knox. We understand that other groups might do things a little bit differently. There's many different technologies to handle each of the components that I'm going to talk about. But we're really proud of what we're doing. We really feel like we're going in the right direction. So I'm going to focus on how we're doing it. And before I get started, I'd like to tell you guys a little bit more about myself. I studied microbiology and cell science at the University of Florida. Go Gators. I then continued on to Tufts University, where I got degrees in neuroscience and biomedical engineering. Immediately after college, I moved back to Orlando. Unfortunately, my mom is somebody who's struggling with Alzheimer's. The youngest brother had left the nest, so I came in there to provide company for her. And I was fortunate to get involved with a company called Vax Design, who did pretty novel research in the area of molecular biology. That company then got purchased by Sanofi, which a lot of doctors here would probably recognize the largest pharmaceutical company in the world. And I've been with them until August of last year, where after Bruce Knox and Jose Hidalgo won the license, they asked me to come on board and help them make medicine out of the plant. The Knox Nursery has been around since 1962. They have thousands of different varieties of plants and liners that they've been cultivating for decades, so they know how to grow the plant, but they needed assistance in making medicine. So that's where I came on board. And my responsibilities as the lead chemist encompass basically from when the plant has been dried to when the final product is made. And there's 5 components to that. We have the decarboxylation of the oil. We have the extraction of our oil. We then have the winterization of that extracted oil. Finally, all the analytical testing. And then at the very end, we have formulations where I'll talk a little bit about the different product types we're selling, talk about ratios, which is a common question from doctors and patients alike, and then maybe a little bit about terpenes if I have time. And finally, I'll just give you guys a scope of the amount of product that we're making. To start off, the decarboxylation is a very crucial part in processing. It's basically where you're activating the THC and CBD molecules. Now, I say activating with quotes because it's somewhat misleading. The THCA and CBDA, the acidic form of THC and CBD molecules that are currently found in the plant, they are active and they provide a lot of medicinal properties. They have anti-inflammatory, anti-tumoric properties, anti-anemic properties. However, they're also very polar. They have a significant, distinguished head and tail to their molecular structure. And this tail is comprised of the carboxyl group, the acid group. Now, if you simply apply some heat and time to your product, to your sample, you actually break away this tail and you convert it into carbon dioxide. What you're left with is a little bit rounder, a little bit more radially symmetrical molecule known as THC or CBD in the case of CBDA. Now, this molecule, by being a little bit less polar, has an easier time moving through your bloodstreams to the necessary organs, and more specifically, bypassing the blood-brain barrier. So I don't know if you guys have seen movies. A lot of times you got some guys with cannabis in their car, going across state lines, and the cops show up behind them. They start eating it. And the reason for that is that they're assuming the cops are not going to be able to identify the fact that he had cannabis, because he's likely not going to get high from ingesting dry, raw flower. Your liver is somewhat capable of doing this decarboxylation process, but it's very inefficient. We require a very large amount of product for it to be able to decarboxylate. That's why in the recreational world, people utilize heating elements such as pipes, bongs, joints, the works, right? In the medicinal world, we have vaporizer cartridges. However, we're not only selling vaporizer cartridges, we're also making sublingual drops, we're making capsules, we're going to be doing topical suppositories. So it's important that we fully decarboxylate our product before we do anything else. And it also, by eliminating any moisture content in the plant, it actually helps our extraction be a lot more efficient. We have, from the beginning, even before winning the license, we were set on using CO2 extracted product. The Department of Health requires that we do everything. All our products is derived from oil because it's the only way that you can accurately get a concentration of that product. When you're dealing with flower, you can get a bud in the top of the canopy of the plant that tests in at 27% potency. You go to the middle of the plant, now you're maybe at 15 to 12%. Down below, maybe you're at 5% if you're lucky. So it's really impossible for a patient who's treating themselves with flower to get an accurate concentration, accurate representation. So when a doctor tells them, take 20 milligrams a day, it's almost impossible for you to do that with flower, right? With oil, it's homogenized. Now I can take it to my high-pressure liquid chromatograph, my HPLC system, and I can just provide it one drop and I get an accurate concentration of that product. And then we can simply dilute that product to provide a measured and a consistent dose. And CO2 extraction is the highest purity of oil you're going to get in a largely scalable manner. It also provides a safe environment for the operator, such as myself being one of them. I appreciate that. Carbon dioxide is what's inside of a fire extinguisher, so the last thing you would see in our facility is a fire. But it actually turns out that it provides the purest oil for the patient. We do a lot of analysis in our cultivation. We're like Aphria, we are greenhouse as well. We do random testing for all the plants that are coming in and any suspicious plants. We do a lot of microbiologicals and mycotoxin analysis, but we are human. And we might accidentally overlook a specific plant that might have some kind of issue that could be carried on. Well, CO2 extraction actually runs at over 4,000 pounds of pressure per square inch. So it basically kills, it eliminates, it lyses any living organism. So once again, it provides not only peace of mind for us, but to the patients as well. After we extract the oil, we have to put it through a process known as winterization. This is required regardless of the type of extraction that you do, whether you're doing hydrocarbon, alcohols, or any other type, you have to winterize the product. And winterization basically just means we're removing some of the unwanted elements out of our oil. Whatever type of extraction you do, you're not only removing cannabinoids out of your plant, you're also removing fats, lipids, chlorophyll, and they're not harmful to you guys, but they're also not beneficial either. And they make the oil very high in viscosity, which makes it very difficult for us to manipulate and homogenize whatever diluent we're using. So we will winterize our oil, we'll then filter it with a Buchner funnel system and a rotary evaporator, and reclaim that alcohol that was introduced for this process, allowing us to offset some of our production costs and transpose it to you guys, to the patients. Now we start the analytical testing component, and this is where my favorite part as a chemist, the fun begins. We are not only doing potency and terpene analysis in-house, we're also doing heavy metal analysis, pesticide analysis, microbiologicals, mycotoxins, residual solvents, all out of our laboratory. We have over $1 million invested in a laboratory and over 50 years of experience in chemistry that really allows us to not only provide the highest level of medicine to you guys at this point, but our R&D is groundbreaking. We have been partnering with companies such as 23andMe and trying to get genomics clinical trials done in our cultivation. And we're going to be actually providing all the infrastructure necessary for such collaborations. And not only are we doing an extensive set of tests in-house, but we've invested in the highest technology to handle each one of these sets. We're using high-pressured liquid chromatography for potency. Potency is arguably the most important test. It dictates how much cannabinoids are present in a given sample, so we wanted to ensure the highest technology provide the most accurate results. We are using headspace gas chromatography for terpene analysis, as well as our residual solvents. We want to make sure we remove the ethanol that was added for winterization. This technology will allow us to see that. We have a triple quadruple mass spectrometer in-house for pesticide analysis. Very unusual in cannabis testing. I worked for Sanofi for 9.5 years. We got our first mass spec 3 months before I left. We have 2 mass specs in our laboratory at Knox alone. This type of technology allows you to detect over 500 families of pesticides. Even though we're not using any pesticides in our facility, we still have the capacity of testing it. We know that the patients can buy this product from from us or 10 other or more MMTCs right now. We want to ensure that you guys have the peace of mind and why you should purchase it from us. Another technology we have is inductively coupled plasma mass spectrometer. Whew. That's commonly found in the biodiesel industry where they're doing parts per billion analysis. We actually can test for parts per trillion with our current system. It's what we're utilizing to test for things such as cadmium, lead, mercury, and arsenic. These things can be introduced via your water supply, your soil. It's not something we're changing from cultivation to cultivation, from batch to batch, but we have the equipment and we have a lot of eager chemists in-house. We test batch to batch no matter what. And then we have the microbiological analysis, which we utilize for testing yeast, mold, coliforms, E. coli, salmonella, the works. Now we're finally ready for formulating the medicine to meet the 11 symptoms that the Department of Health allows us to treat. And we have, from the beginning, from our inception, came out with vaporizer cartridges and sublingual drops. We wanted to provide these 2 forms of medicine because they behave differently in the body, right? Cartridges will provide an immediate effect. It has a much lower absorbance rate, so it stays in your system maybe an hour to 2 hours, depending on the person's metabolism. We have sublingual drops, which take a little bit longer, but stays in your system for a far greater time. So depending on the symptom you're trying to treat, one form would be more ideal to others. Vaporizer cartridges are really the primary type of medicine for people, for example, with PTSD, who want to dose themselves as they're feeling anxious, maybe Crohn's disease patients. where sublingual drops is more ideal for people such as people treating themselves for epilepsy, where they need a certain amount of cannabinoids present to prevent a seizure from occurring. And we're also under development for capsules as well as topicals. Capsules, we were going to be in the market with it last month, but we decided to take a different route. We're going more into the soft gel caps, which provides the fastest metabolism for capsules. We want to eliminate the 60 to 90 minutes and bring it down to 30 to 60 minutes. We know it's the most compatible form of medicine in the current demographics here in Florida, so we wanted to make sure we have the best one available. And then topicals, I believe, will be coming out into the public for maybe another 2 to 3 weeks. We'll be ready. We have the formulation ready. We're just waiting for packaging. And capsules and topicals are where we're going to introduce these unique ratios. It's going to be where we're going to introduce a 1-to-1 blended strain. These ratios are a common topic for doctors and patients alike, and they're, aside from just providing a balanced CBD and THC, providing the maximum medicinal component to the medicine, there's something more intrinsic going on. Your endocannabinoid system, the system that actually reacts to these cannabinoids that we're ingesting, they actually have pathways and they have receptors in them, such as CB1s and CB2 receptors that react to molecules such as anandamide or THC or CBD, right? Or the other cannabinoids that are present. And THC mimics a commonly produced chemical in our system, usually associated with eating a satiating meal or a heavy bout of exercise. Our body dispenses these anandamide molecules which activate these CB1 receptors. THC actually mimics this molecule, so it fools these receptors into being activated. CBD, on the other hand, will partially bind to these receptors, non-activating it, but preventing THC molecules from activating it. So what it allows you to do by introducing these unique ratios of CBD to THC and vice versa, you can really increase the dosage of, let's say, THC without providing some of the psychoactive impairment that's associated with it. So for patients dealing with cancer, for example, or other types of symptoms that require a significantly high dosage, by introducing a ratio of 1-to-1, 2-to-1, 3-to-1, with some more CBDs in there, you're actually mitigating some of these psychoactive aspects of it while still providing the THC benefits. And then there's indica, sativa, and hybrid. People are like, wow, there's another Venn diagram there. Well, this is more related to the terpene content of the plant. Indica and sativa provide a really significant dichotomy from one another. Indica being more sedating, more relaxing, more ideal maybe for night medicating. Sativa more, euphoric, a little bit more energizing. A lot of people like to take the sativas during the day. And Knox is unique where we provide multiple products under each one of these categories. We understand that everyone's body chemistry is different, and we understand that some people might be more receptive to certain terpenes over others. So we didn't want to just provide one indica, one hybrid, one sativa, and one CBD. We're providing multiple products under each category, as you can see, because we understand that you guys are unique, and we want to be able to provide options. If something didn't work as well as you expected it to, you have other options under the same category. I hope you guys learned something. It was fun. You guys have a good night. Thank you for listening.
Thanks, Alex, man. All right. I hope this is as educational for you guys as it is for us. Remember, we will take questions. You guys can feel free to mill around to the booths during the presentations. I just kind of ask that you are kind of quiet so that people that are trying to listen to the presentation can hear. We started off with Three Boys Farm, who I had mentioned was an administrative licensee and was awarded a license about 2 months ago. Our next presenter was also in the group of those administrative licensees, and they're known as Treadwell Nursery, but tonight they are debuting their brand right here before anybody else hears it. Remeny Wellness, and I'd like to welcome Dr. Wilson King to the stage. Doctor?
Good evening. It is really a great honor to be here tonight. I thank Dr. and his staff for inviting us. It was an unexpected but very, very gratifying invitation. Thank you. And thank you all for it's such a great turnout. This is wonderful. And we are excited. This is our first event ever. Okay, my name is Dr. Wilson King, and I'm a board-certified OBGYN in integrative medicine practice. I use botanicals. Can you all hear me fine? A little closer? Hey, that might be better. Okay. I thought there was something a little odd. I use botanicals in my practice, and during my research into the use of botanicals, I ran across a book by Dr. Lester Grinspoon. He is a psychiatrist who is now professor emeritus at Harvard Medical School. He wrote a book called Marijuana, the Forbidden Medicine. And he set out to disprove the value of cannabis. And the book is a collection of anecdotal patient stories with patients saying how cannabis helped them. Well, there was a chapter that stuck out, and it was a chapter on aging. And it showed how aging patients were being impacted by the use of cannabis. There was one story, an 80-some-year-old man, actually it was a group of 6 siblings. All of them were in their late 70s, early 80s. They were all mentally sharp, mobile, on no medications. They grew up on a hemp farm, and hemp was a main staple of their diet, and they continued that into their 70s and 80s. They ate hemp. Hemp is a great fatty acid, omega-3 fatty acid. Hemp has a lot of nutrients. Dr. Grinspoon became a believer after he wrote the book, and he started out being a non-believer. After I read the book, I said, and then I dove into more research. Then I decided I needed to help bring cannabis to the patients in Florida. So in 2014, I began doing some educational seminars. I also joined, actually I did that before, I also joined the Society of Cannabis Clinicians, which is a California-based organization where physicians get together and have discussions, journal discussions, patient discussions, and just share information. It is open to not just physicians, but nurses and dispensary people and patients are all welcomed into the Society of Cannabis Clinicians. You'll really learn a lot of information. I'm also the Florida representative for the Doctors for Cannabis Regulation, DFCR. And what we are, a group of physicians who want to end the prohibition against cannabis. We believe it's a medicine. We believe it is much safer than alcohol or cigarettes, or of course, opiates. And we believe that people should not be put in jail for cannabis. And speaking of that, I am also an expert witness for cannabis legal cases. These are patients who've been arrested for the possession of cannabis, and I provide the medical expert opinion. Every case I've done, the charges were dismissed. So we are fighting for cannabis. Now, I've known the Treadwells for years. And when I've known them professionally. When they were initially considering getting into the industry, they approached me and asked my opinion about cannabis as a medicine and about them getting into the business. Well, at the end of the discussion that day, of course they had already known my value professionally, But by the end of that discussion, they knew I was fiercely passionate about cannabis as a medicine. And I was saying, yes, let's just dive right in. Let's go for it. So the Treadwells, okay. The Treadwell Nursery has been in existence for more than 40 years. It is a family business. Glenn, Sharon, and their 3 daughters. Tom and June Simpson and their sons owned a health-related business, a very successful health-related business, and also June's orchid estate. So the 2 families got together. Both are Floridians, native Floridians. They got together and formed a union. Now, I gotta make sure I stay on task here. I'm going to explain where the name Remeny came from. Glenn Treadwell always liked to use the phrase hope for hopeless people. Sharon Treadwell came up with the name Remeny because Remeny is Hungarian for hope. Thus came the name Hope for Hopeless People. Isn't that cool? I'm going to tell you a little bit about our process. We are a new licensee, so we are in the process of getting our cultivation authorization. We will be using hybrid greenhouses. What that means is it's a greenhouse in which you can control the environment. We can control the temperature. We can control the humidity. We can utilize the Florida sun. We can make it dark when we need more darkness time. We can make it light a little longer when we need more light. So it's a really neat way to grow cannabis. We will only be using, and I think everybody has said that, we will be using everything consistent with organic protocols. Not organic protocols for cannabis, but organic protocols for food products. But it will be organic. We will be growing a variety of profiles that we think patients and physicians will be excited about. We'll grow from high CBD to 1-to-1, high THC. Our group focuses on the whole plant medicine. What makes us unique? Well, it is a family business. Our core team has been together since day one. And we have traveled Colorado, California, Oregon, and all around the state of Florida. We've had road trips. And after all of that, we still like and respect each other. Most of the time. You know how families are. You know, you get into a little something, something, but you work through it, and you love each other, and you keep going. For us also, diversity is important. Half of our core team is female. Yes. 2 of our core team members are veterans. And one of our core team is a woman and an African American. I don't know who that might be. But we are all focused on the same goals, have the same mission, coming from different perspectives, but we realize that it's all about the medicine, not us. Our processing protocols, we will be using clean extraction technology, similar to what you've heard here as well. We will do, our goal is to preserve the whole plant. Our processing facility will exceed the state requirements for GMP protocols. The GMP stands for Good Manufacturing Practices, and that's basically for food, but we want to go beyond that. We will be doing extensive on-site testing and third-party testing. All of our test results for our products will be on the website for your perusal and to check out. And of course, terpenes are important, and I love what Alex said. The terpenes are what labels the medicine as indica or sativa. And we will be doing our best to preserve the terpenes because they are important in the medicine as well. Our product lines and dosages. It's interesting to be standing up here talking about something that we don't even have yet. But this is our plan, okay? We'll have vape pens, tinctures, sublingual sprays, oils, topicals, suppositories, you name it. Our plan is to have all of that. Our vape pens won't include any fillers or added agents. We want to try to make this medicine as clean and pure as possible for you all. We'll have consultations at the dispensary locations if anybody's having trouble taking the medication as directed by their physicians. We will be there to support the physicians. One of the goals, well, I'm getting ahead of myself. Let me talk about the labeling. The labeling will have all the information you need on it. How much THC, how much CBD, and what's the terpene content. Yes, our dispensaries will provide a variety of services, programs, and discounts for our patients. They haven't been established yet, but we're getting there. We'll offer fast and convenient statewide delivery options. Now, one of the things I want to point out is that we plan, patient and physician feedback is really, really important. If you don't see a mode of delivery or a dose that you want to see or a product that you would like to see, we want to hear about it. We want your feedback. We want to give you what you want and what you need to help your condition. As the medical director, and actually I think I'm the only female medical director out of all the organizations. How about that? But as medical director, yes, women clap, yes. As your medical director, as Remeny Wellness medical director, I have an open line of communication with physicians. Whatever they need, whatever they want, whatever they have questions upon, I am there to answer them. I will go to physician offices and help them as needed. That means patience. You got to talk to your doctors, encourage your doctors to reach out. Patients can contact us too, but I want it to be, make sure it's a triad. We have the physician, we have the patient, and then we have the dispensing organization. We are all there to help you. And please visit our table, ask any question you want. Sign in on our email list so that we will send you updates as to what's happening at Remeny Wellness. And we are excited to be here and to be a part of this industry, and we want you to be excited too. Thank you very much.
All right. We're moving through, and let's see where we are. Next up, where are my friends from Surterra? Oh, and look who I get to introduce. This is kind of a funny story. So when Dr. Gordon and I decided to open the practice, we had to communicate with the office. At the time, it was known as the Office of Compassionate Use. And you know, this was right after Amendment 2 had passed. There were very few doctors in the state that were practicing, even fewer deciding to open up on January 3rd when Amendment 2 went into effect. So back before the days of having to wait on hold for an hour and a half with the office, I called and I spoke to a woman by the name of Kimberly Hawk. Kimberly was our initial contact at the Office of Medical Marijuana Use, and she was greatly helpful in helping me navigate my 60-year-old doctor through the morass of the state's registry system. Unfortunately, Ms. Hawk doesn't work for the Office of Medical Marijuana Use anymore, but she does work for Surterra. So, ladies and gentlemen, Kimberly Hawk.
Thank you. Can y'all hear me okay? Oh, yeah. Oh, hi. Sorry. It's been a while since I've been on a microphone. How's everybody doing? Are you inundated with information? Are you learning a lot? I hope so. I know. Every single company here, I've got relationships with most of them, and I swear they're just the salt of the earth people. So you guys are getting a lot of really good education, and I'm really happy about that. But Mr. DeLuca's right. That was me at the Office of Compassionate Use. But no, I found my home at Surterra, and I'm really excited to tell you guys all about it. But I know you guys are glazing over just a little bit, and you're about ready to have that happy hour glass of scotch or something before bed. So I'm not going to keep you too long. I promise. I am with Surterra Wellness. Surterra Wellness is one of the original 5 licensees in the state of Florida, and we've been operating here with qualifying patients since about 2015 when we were awarded our license. So moving forward, it's just my name and a wonderful, relaxing photograph. Prepared to serve, and we mean it. So we love quoting William Foster. He was a Marine. Quality is never an accident. It's always the result of high intention, sincere effort, intelligent direction, and skillful execution. And we take that to heart. We want to make sure that the medicine that we are crafting, we craft it by hand, like most of these folks here. We craft it by hand. We want to make sure that it is safe, it is natural, and it is consistent. And every single thing that we do, from patient experience to product quality at Surterra, is intentional. We run our farms to ensure quality and consistency. So you guys have gotten some really great rundowns from the other companies about how they cultivate, and most of it is, I would say, pretty standard. We all focus on all safe, natural, organic ingredients. We have a mineral-rich proprietary blend that we feed our plants. To that end, we're the only medical marijuana treatment center that has 2 cultivation sites in the state of Florida. So we cultivate in Leon and in Hillsborough counties. In total, we have about 300,000 square feet of cultivation space. Our site in Hillsborough County, I'm just touting, I'm just saying numbers right at you right now. It's the worst, I'm sorry. Our site in Hillsborough County is going to be the largest medical cannabis cultivation site on the East Coast. So we're really excited about that, to be able, again, prepared to serve. We are able to fulfill your needs in terms of your cannabis-derived medicine. Wellness centers designed to welcome and educate, and again, we also mean that. A photograph of our wellness center in Tampa. It's our flagship center. All of our wellness centers are designed with the same look and feel. Now, we did a lot of due diligence when we started Surterra. We did a lot of market research, and what we found was the strongest negative response that people had to medical cannabis was a hatred for pharmaceuticals. Is anyone surprised? No, not so much. Okay, so the strongest positive response. Can anyone give a guess? I just want to know. Anyone, what do you think of when you think of medical cannabis? What's your strongest positive response? I'm sorry? It works. It does. It works. That's wonderful. Well, yeah, no, the most positive response that we got in this market research was people equated it to organic food, and they equated it to their grandmother's kitchen. And so we took that to heart. When you walk into any of our wellness centers, all of them, you walk into a kitchen. And so most of our questions and answers, most of our educational bits of what we do happen around a butcher block top kitchen island. And we'll make a cup of coffee and we'll just sit down and have a chat about where you are in your journey to wellness. Newsweek featured us as well as a leader in dispensary design. Again, that's just me having a little bragging time. But if you can't make it into our home at one of our wellness centers, we'll deliver to your door. Miami, the Sticks, anywhere, $10 delivery fee across the board. And I said this to a woman earlier today, it's less than my Chinese food guy, so I'm really quite jealous. But yeah, anywhere in the state of Florida will deliver for $10 fee. All right, now, there are a lot of medical cannabis companies in the state of Florida. There's a lot of medical cannabis companies in the nation and abroad. Now, what most often you will find is a strain-specific process. This is where the medical cannabis companies begin to differentiate. You'll see the processing. So a strain-specific process is the standard. You will have a particular strain of cannabis, you will extract it and refine it to the best of your ability, and then you will bottle the properties into a final product that you'll find on the shelf. And that's really great, but there are a few things that are missing from that. Now, first of all, you think, yes, that is all natural, that is safe, 100%. And it can be. However, you need to know the exact cannabinoid content, and you need to know the terpene profiles that are located within that strain. Because I know that you know, because a lot of really informed speakers have come before me tonight and said, terpenes make the strains. So if we know that terpenes differentiate the strains, that's the important thing to pay attention to. More sedative effects, more energizing effects, calming and focus. I need calming and focus, me personally. So if you've got a strain, let's say Banana Kush, and you feel comfortable, Banana Kush has quelled my tremors, I feel comfortable with that strain. That's great. You feel comfortable with the general cannabinoid content that usually occurs within that strain. However, that's different. Harvest to harvest, location to location, how it's cultivated. But you're really used to the terpenes, about how that product is making you feel. If it helps you get out of bed or if it, not so much. And so at Surterra, we've decided to take a different approach, which I'll touch on in a second. So this is a graphical representation of the third-party testing data of a medical cannabis company in Florida. And again, this data is available online. We've just represented it here for you guys so you can see. The THC is indicated in the solid lines. The CBD is all the way down here. Now, we know also from more informed speakers before me this evening that it's an entourage effect that we're looking for. CBD and THC do best when they work together. And they work even better than that when they've got terpenes in their little group of friends. So you can see over time, it's inconsistent, basically. So if you were to buy one product 1 month, you assume that it's the same product. You buy that product a couple months later, and it has a different cannabinoid ratio within that product. Now that's something that could cause a problem in terms of seizure patients who are just used to, yes, it's this product that quells my seizures. Suddenly they buy a product and it doesn't have that same cannabinoid ratio. That's why we emphasize at Surterra, know cannabinoid contents, know the quality of your medicine, know your ratio that works best for you after you've found it over some time. Now this is Surterra's chosen process. It's an effect-driven process. We cultivate a medley of strains. I'll take you down to our cultivation sites and I'll show you. We cultivate actually I got this from our Vice President of Production today, 22 different strains of cannabis, indicas, sativas, hybrids. Those are not bad words. It's just that what differentiates those strains are, again, the terpenes. So we cultivate those strains. We exact the THC and CBD. Now, our ability. Surterra is extremely proud of the fact that we are able to refine that cannabis oil to a level of 90% purity. That is ridiculously high, ridiculously unprecedented. We refine it to that level of purity, and we're able to elementally take the THC and CBD cannabinoids and formulate them into those exact ratios that I was just describing to you before. Once we have done that, once we have extracted and formulated those ratios of the two major cannabinoids, that's when we reintroduce targeted terpene profiles back into our products, so that those products end up doing what our patients are seeking. So you don't have to rely on the whim of Girl Scout cookies or blue glue or something of that nature, which if you're used to it, awesome. I want to try to help you find out what terpenes are in that strain that you're used to and what terpenes we have in our products that have that exact same effect. But the difference is that you know exactly what those things are this time. So that, in a nutshell, is how we are able to formulate our medications. And I actually today, in a publication, someone referred to our effect-driven process as cannabis sorcery. Loved it. Just loved it. Because I don't know anything about that. I don't know any of us that are actually sorcerers, but I thought that that was precious. So, as you can see here from the data, the same exact time frame, our third-party testing. Does anybody notice a difference in these lines from the previous graph? It's a little bit of an eye-opener. Now we're starting to understand that consistency is a little bit more important than we thought originally. So we want medication to be safe, we want it to be consistent, and we want it to be natural. And that's exactly why the founders of Surterra started Surterra in the first place. Why apply my talents somewhere where I could, you know, make gobs and gobs of money, which, you know, I can tell you not a lot of us are, but, you know, honestly, gobs and gobs of money and apply our talents in certain areas, or we can actually help people. That's actually a little bit more impactful. And we want to help people consistently. My mother's had cancer 12 times. I say this a lot. She's got a very extensive history of cancer. I hate going to hospitals. And I got to tell you, I would want to know what's in her medication. I would want to know what the levels are of THC and CBD. I'd want to know what terpenes are in there. What is this product going to do for my mother? How is it going to help her? And I wouldn't refer her to anyone that I didn't know that. So that's the most important thing to pay attention to when you're selecting who you'd like to purchase your treatments from. And to that end, this is a representation of our product families. And again, they're differentiated between the exact levels of CBD and THC in each product family. So 12.5 to 1 CBD to THC on the calm side, all the way down to our relief line, which is a 1 to 9. That's again, oh, am I fading out of existence? Sorry. So that is a 1 to 9 ratio high THC relief line. That oil is not only 90% pure, but that relief line 90% potent. So again, potency, purity, safety, important to understand what's in your medication. Now, underneath there you can see our two most popular routes of administration, tincture oils for every single product family and every single concentration within those product families. So the way I kind of describe it and the way my country bumpkin self kind of understands it is that you got Tylenol and you have Tylenol extra strength. It's the same medication, but one's a higher concentrate. So for Serene, let's say, our 5 to 1 ratio of CBD to THC, you have a 20 milligram concentration or a 45 milligram concentration. It's the same ratio, but it's a different concentration within that dose that you're taking. So it depends on what your physicians have recommended. It depends on your condition. Your endocannabinoid system is vastly different from mine. We could suffer the same condition, take the same product, and it have different effects. So I know you guys are a very educated audience. I know that y'all get that for sure. But it's important to know what your options are. And by the way, tincture oils and vaporizer pens are not our only routes of administration. You guys can see more of that back there behind you, but we have topical lotions, the tincture oils, of course, oral sprays. However, if you can't find a mirror and you can't look underneath your tongue, oral spray just like Banaka in the emulsifier. And we're coming with transdermal patches in December and capsules in February. So that's going to be really exciting. Oh, and also edibles. We have just petitioned the Department of Health to finally light a fire under their tuchuses so that they can make those rules a little bit faster, my guys at OMMU. Our vaporizer pens. So this is great. We're really excited. So not only should medication be safe and consistent, but it should also be affordable. Now what we notice is that we are able to reduce our vaporizer pen cost from $45 to $25. A lot of folks were using or are using vaporizer pens because it's a smaller amount of medication within that product unit, using that to titrate up or down to see what ratio of CBD to THC works best for them. And so why not make it more accessible if we can? And so we did. And so that's $25 a pen. They come preloaded. We have new hardware as well, so why not roll out everything at the same time? It's new hardware, so it comes preloaded. It is disposable, no need to recharge. We have a recycling program. Just give us the empty pens back when you're ready, and we'll supply you with new ones when you place your next order. And before I close, there is something that I do want to touch on really fast. Now, a lot of folks, just like you guys, understand the terpene talk, I guess. I really like alliterations, the terpene talk. So you guys do get it, that you know that terpenes are what make those products have the same kind of effects that you're looking for from different kinds of strains. Now, what we're doing with Dr. Gordon's office, which is really exciting, is we're launching kind of a test combination product. And you guys are actually the first to hear about it. So if I don't explain it adequately, I apologize. But we're calling it the AM and PM. So we're going to have pairings of vaporizer pens in each product family. And those pairings are going to be an AM and a PM to try to help you understand that the terpenes that are within those products, within those ratios of cannabinoids, one is for the morning, help you get those energizing effects. One is for the evening, help you get that sedation that you're looking for. Again, those will be sold in pairs. We are going to be delivering those products to patients who order them to Dr. Gordon's offices November 4th and November 11th. Actually, yes. And if you like what you have, or even if you don't like it, if you write us a review, we'll give you a coupon code to have a free vaporizer pen after that, just for your trouble of writing that review. So we're really excited to see if that works. You know, I believe that there was the medical director over at Remeny. She said it's really great to be able to help patients in this way and to help it be accessible. And I really appreciate your presentation. Everybody's here, actually. But again, the only thing I want to leave you with is that it's exciting to have that patient feedback, just as the medical director said, to have that patient feedback and physician feedback. So we've been very grateful for Dr. Gordon's offices and the patients that see him to give us that feedback that AM and PM might actually be a really good idea. So let's test it out. Thank you guys for your time. If you guys have any questions, I'm obviously in blue, so thanks.
All right. Thank you, Kim. And thanks to Surterra, too. You know, we have had the privilege of being able to meet a lot of the MMTC executive staffs and tour the cultivation because we wanted to inspect their manufacturing processes to ensure that our patients were receiving good medicines. And it's really exciting that they listened to our concerns and our patients' concerns. And in particular, Patty has been instrumental in getting this AM/PM product launched. So we're very, very excited to announce that tonight. I think that what we're going to do in the spirit of time, and since the dispensaries, the MMTCs, have set up such nice displays, we're going to do one last presentation, going in alphabetical order. Oh, wait, what is this? Oh, I don't know how that other slide got in there. Last but not least is Trulieve. After Trulieve, rather than do a Q&A, you guys can go to the respective booths if you have questions, rob them of all their free stuff and their Chach and merch, and direct your questions to them individually. That'll save us some time. I'd like to introduce to you Victoria Walker from Trulieve.
All right, I know you guys are exhausted and you probably have a lot of questions, so I want to make sure I leave you with enough time to visit all the booths and ask your questions. So I'll get started. I'm Victoria with Trulieve. Trulieve was the first licensed dispensing organization in the state of Florida. So we've been in operation for well over a year. Our first store opened up in Tallahassee last July. So we have a lot of experience just all across the board, from cultivating products to operating dispensaries and working with all the patients and learning from you guys and really tweaking our processes and instructions on which button to push. Not okay. Here we go. So we cultivate our products in Quincy, Florida. It's about 30 minutes outside of Tallahassee, and we grow all indoors. So we actually, our grow is built inside of another building. So we have some of the most amazing facilities, pesticide-free, sealed tight, like Fort Knox. And you can see pictures of our baby beds, our growing rooms, our drying rooms, and these are all of our employees. This is Craig. He's our engineer that does a lot of our innovative vaporizers and cartridges, and is always thinking about new products. He's really, really brilliant. We use an ethanol alcohol extraction process. We also lab test on site. We have a state-of-the-art lab where we lab test our products, we lab test other products, and we also use American Clinical Solutions as our outside lab organization, so they're located right here in Florida. And when you go to our website and look up product batch number on your product, you'll find the lab report for that internally, our lab report, as well as ACS's lab report. And those are all on our website. Our goal for products is essentially to have a product for every patient. And so that's why you see our product line being so large, is we know every single one of you out there has a different preference. And so our goal is to not niche ourselves into maybe a couple products, but to have something for every single patient in whatever stage of your treatment that you're in. So I'll start with inhalation. You've heard a ton about, and you've all are in the process of becoming patients if you aren't already. So you've learned a lot about the process, so I'll just talk about what we offer at Trulieve. Our inhalation product line, so this is one of the most popular delivery methods, obviously, in the state of Florida. We have 3 types of vaporizers. This is sort of our beginner pen. It's very easy to use, no buttons. It's a great pen for a first-time cannabis user. And then we introduced our Mystica pen, which is our 2nd generation. It allows for a stronger pull, a more higher dosing for those of you who are ready to kind of graduate from our beginner pen. And then we have our Heroica vaporizer, which actually vaporizes ground flower products. So while smoking flower is legal in Florida, you can't vaporize it. So we've had this product since the beginning, and it's the only way to get the ground bud into your system through vaporizing. And we're on to our 2.5, our second generation of introducing a flower
vaporizing product with the Department of Health. So hopefully we'll have some more information on that soon. But we offer the largest variety of strains and sizes in our vaporizing products. So these are all the strains we offer currently: hybrid, sativas, and indica. And we're only going to continue to grow. I think if you've noticed, we rotate strains, which is exciting. So if there isn't something that you like now, feel free to suggest. We're constantly looking for what patients are searching for in our strain profiles. Our oral and sublingual, this is obviously the 2nd most popular delivery method in the state right now. So we offer capsules. We offer them in 10 milligrams and 50 milligram varieties, as well as all of our various THC strains, CBD and 1-to-1. We offer oral syringes, which go under the tongue. So it's cut with olive oil, and we offer those in all the strains, as well as CBD. We have a CBD tincture, and we just released a 1-to-1 tincture, which is exciting. So it's half CBD, half THC. And then our TruClear. Our TruClear has definitely proven to be one of the best values on the market, because a little bit goes a very long way. It's we just relaunched it in this new glass syringe, so patients are very happy with that. If you have tried the old, I encourage you to get out and try the new syringe. We dropped the price because we dropped the milligram amount a little bit. So it's now $60, 850 milligrams. It's an incredible value for a lot of patients who are looking for higher dosing and something just to last a little bit longer. Our topical cream is available in a hybrid THC strain, and we also, you're able to use the TruClear as a topical as well. It's really great for spot treating certain conditions, and it's a very powerful THC product, so it's another option for a topical application. We're soon going to have a sativa TruClear for those of you that are interested. In probably 3 to 4 weeks, we'll have the sativa line of the TruClear. Right now we have 2 hybrids and an indica, so I know patients are anxiously awaiting the sativa line. Right now we have 10 locations. Our 11th will open up on Friday in Gainesville. Not really convenient to most of you, but we're really excited to be more centrally located in the middle of the state. North Fort Myers, we're having our inspection this week, so we hope to be open in the next 2 weeks, 2 to 3 weeks, I'll say, I guess, as a just to make sure everything goes well. So we're extremely excited to offer 2 dispensaries on this side, and we've got Bradenton that's been open for a few weeks now. And then Orlando will probably be the last one that we open in 2017. So we're excited about that, hopefully towards the end of November. And then look out 2018. We want to be everywhere we possibly can be. So Venice specifically, we are working with the town. We're in the special exception process to open a dispensary here in Venice. The Gordons have graciously agreed to host our meeting with the town, which will be in a couple of weeks, where the neighborhood meeting, so residents and local businesses can come out and hear what our plan is for a dispensary here in Venice. So we're excited. We hope to have that open as soon as we can. Do you want the mic?
Everybody, speak up to anybody you know in Venice. It's going to be really important to let
and we've operated this many dispensaries for a long time, and I can tell you, we've never had any incidents. I think we're of value to the neighborhood and the community that we go into. It's really exciting. We've never had anybody in the neighborhood be concerned that we're there. The patients, you guys are wonderful. It's just a stigma that we'd like to dispel. So thank you for your support in that and for being so supportive of the locations that we have put in place, because it just shows the need so desperately for these locations so that you guys have access. And again, speaking of access, it's our priority. So our call center is open 7 days a week. Hopefully most of you have had contact with them. We're open Monday through Friday from early in the morning till late at night. We're open on the weekends. So if you have anything that you need from us, you want to place an order, you have questions, concerns, a product concern, give us a call. Our stores are open 7 days a week. We only close 3 days a year. So we're there when you need us. Unless there's a hurricane. That was a little bit of a hiccup. And we deliver next day throughout the entire state. So our goal is, if you call us, our cutoff's about 3 o'clock. So if you call us before 3 o'clock tomorrow, for example, we'll be able to deliver it to you next day. So we try as hard as humanly possible just to make patient access a non-issue for you guys. We'll do whatever it takes. We rapidly expand our call center, hiring constantly cars, drivers. It's just whatever we need to do to get out to you guys is what we do. Our website is a wealth of information. All of our products, all of our pricing, our lab reports. You can shop online through our website and pick up in the store, or shop online and have it delivered. We'll call you to schedule your delivery. So if you just don't feel like picking up the phone, you don't have to. So we want to have something for everybody. We'll be launching our app next year, which will be really awesome. You'll be able to shop on your phone, read about new products, review products, all that great information. Our website is the most up-to-date place to find everything you need to know about what's going on at Trulieve. So make sure you check it out. We also have a lot of resources in here for physicians or community information if you're trying to kind of educate other people around you. Trulievers. So we hope that all of you become Trulievers. We offer a couple of different discounts. First-time patients, 15% off. All patients receive a $75 credit towards a purchase of $150 or more to offset that state ID card cost. So while the state has issued a cost to that card, I think all of the organizations offer a discount. So it's great. You guys are, making your money back a couple different times if you shop around. So I think that's great that we all started offering that. 10% off for vets and SNAP card holders every order. And then our Trulievers program. So every $500 you spend at Trulieve, you get 10% off your next order. And if you're a vet or a SNAP card holder, you can double that up for 20% off. So we're constantly trying to do as much as we can to help with patient costs and access. We have Trulievers all over the state. So we love our Trulievers. We hope everybody pick up a sticker, share it with pride, and make sure to follow us on Facebook. Everything that we launch, new products, store openings, we communicate it via email and through the doctors, but we do a lot of really important information update on our social media as well. So thank you so much for having us, and I'll open it up to questions.
All right, so let's just recap here real quick. So tonight we've introduced a brand new MMTC. We've learned of a brand new product from Surterra. And we just had Trulieve say that they intend to put a dispensary in Venice. So those are some pretty big announcements. Do you have a few words, Dr. Gordon?
I do. First off, I want to thank everybody for coming. I want to acknowledge the other physicians that are here tonight. We welcome you, and we look forward to working with you to bring the best program to Florida that we all know that we need more of us out there doing our thing. Dispensary guys, before y'all pack up, please, I want to get one group picture. I know. We will. But okay, good. But anyway, everybody, thanks for coming, because we got to get it out. I mean, everybody's here. It's fantastic. Thank you.
You guys can feel free to go talk to our dispensary partners. Our next support group meeting, the last one of the year, will be here Thursday night, November the 16th from 7 to 9. And it's going to be how to talk to your family about cannabis over the holidays. You guys have a wonderful evening. Thanks for coming.